stage. Why don't I give you a couple little thoughts about this? Yesterday we started talking about the Affordable Care Act and how prevention is becoming policy. And when that became a pillar of the Affordable Care Act, we're actually looking at companies, organizations that are doing these incredible employee benefit programs and wellness programs, and they really are inventive programs that we joke about them becoming your boss, like your new trainer is your boss. But ultimately, they have lots of different incentive programs out there that are pretty robust. And I'm really, really excited to have an incredible group here to talk about this, because it's really changing the way companies hire, the way companies incent, and hopefully the way that they have increased job performance. So I'm really interested to hear what everyone has to say. It looks like Kristin's on her way up. So I'm going to introduce the moderator for the session, and she'll introduce everyone else. Kristin Van Busum, she is the manager of the Health Advisory Services at RAND Corporation. And in line, again, with our mottos, she is awake and unafraid. Enjoy. Thanks.
Wonderful. I'm very excited to be here because typically at RAND, when we think about workplace wellness, we're always analyzing it from the 35,000-foot view. So it's really fun to be on the ground and see a little bit more about what types of innovations are taking place. Kristin, do you want to go ahead and introduce yourself, and then I'll talk a little bit about the work that RAND's doing after you all introduce yourself.
I'm the Vice President of Health and Wellness Business Development for Jawbone. Prior to that, I was the CEO of BodyMedia, which was just recently acquired by Jawbone. So a little bit of a story there.
My name is Paul Lockington. I'm the sales manager for Dynastream Innovations Personal Monitoring Division.
Chris Boyce, CEO of Virgin Pulse. Our goal and what we try and do is it's corporate wellness, but change behavior is really what we're focused on, is getting people to actually change their behaviors and then tracking that and making sure that they're successful in that.
And I'm Derek Newell. I'm the CEO of Jiff, and we're a wellness platform that allows employers to access the digital health ecosystem and provide those to their employees in a way that hopefully engages them and changes behavior.
And at RAND Corporation, we plunged into the ecosystem of workplace wellness about 3 years ago. And last year, we published a congressional report assessing the state of workplace wellness. So we had a large-scale national study that was representative of employers in the United States. We did a number of case studies, and we had the very rare opportunity to do a longitudinal analysis with some large companies. So we were able to really assess what is and is not effective. But again, this is at a very large and global scale. But just to give you a sense of what the landscape is, because I'm not sure if all of you know, I wanted to let you know some of our findings. So first, we found that workplace wellness programs are pretty common. So about 50% of employers are trying to promote wellness in the workplace. We also found that programs primarily consist of screening activities. So some of you may take health risk assessments online or have biometrics taken in the workplace. Other programs consist of lifestyle management and then chronic and disease management. Some of the discouraging findings we found that less than 20% of employees are actually participating in programs. Specifically, lifestyle management programs. So we have very, very low engagement rates, even though employers are really interested in investing in these programs. And perhaps the finding that got the most attention was, and in fact this was published in Forbes by Dan, the prior moderator, we found that cost savings are neutral. So that went against a lot of hype that was out there previously saying that there were high ROIs, cost saving potential of up to 3 to 1. So we had a little bit of tension in our office when we found that and trying to figure out how to release that appropriately. With that said, I think there's a lot of opportunity for improving these programs through innovative tools like our panel has been working to develop and promote. So what do we need to do? We need to improve engagement. We need to think about how these tools can be implemented cost effectively, and we need to figure out how to evaluate programs intelligently, which all of you have been working on, how to evaluate tools, which tools are effective and what outcomes are actually effective. So could we go ahead and get started and talk a little bit about how your products are helping to improve engagement and help sustain behavior change, because we all know that's really hard.
Fantastic. I'll jump in. Is that all right? What we found is that engagement is a multifaceted, multi-pronged problem. Most of our clients, in fact, all of our clients are saying to us, healthcare cost reduction is important, but we actually want this to be a great experience for our members. We want people to be engaged. This makes us a better place to work if we're successful in doing so. And so devices, we found, is one of those key things that will help engagement over the long term. So Jawbone, Fitbit, any tracking devices are usually pretty useful for the members to use and then become engaged. But that's not all you need to do. There's incentives that play a role. There are competitions and challenges. There are social things that need to be in place. We have found that actually, if you can get a majority of the population to change their behavior, those who aren't in the majority then start looking and saying, gosh, they're doing it, I should do it. So you get a positive cycle that goes on. So tapping into those social networks is a really powerful way to go from kind of external behavior change to intrinsic behavior change for most of the population. There's a lot of tools that you need to have in order to sustain behavior change and engagement over the long term.
I'd just like to say tangentially relate to your story about the 20% engagement. So just tell a little story. So most corporate wellness programs, right, in the last 5 years, they're changing radically now, but it's like, okay, I'll go, I'm the employer, I want you to go, and I want you to get a needle stuck in your arm. I'm going to draw some blood. I'll pay some money to do that. I'm going to send the blood to some third party you don't know about. They're going to analyze the blood, and then some company you've never heard of is going to call you and say, hey, guess what? You have high blood pressure or high cholesterol. Let's talk about it, right? And of course they don't have engagement because that's an awful human experience, right? It's just, it drains everything from the bank account. Everything that we know about humans, that goes against the entire experience. Guess what? It's clinically exactly the right thing to do. Know your numbers, manage your numbers, but it's a terrible human experience. And so this Naga nurse model that we had, and I built a huge company that did that between 2000 and 2006, right? So, and then I went into remote patient monitoring because I'm like, this digital health thing is really interesting, and now I'm at Jiff. But you have to create human experiences that are wonderful, right? That are interesting. And I talk about experiences because it's not user interface, it's experiences. And you mentioned the word experience. So the other thing that's dramatically changing is our ability to, and we sort of learned this in remote monitoring, is if you give people real-time feedback on their behavior, it's way, way more effective. So in those old models, it's like you get stuck, you talk to a nurse, you get your $100, you hang up the phone. A year later, you get stuck again, and oh, wow, there was no improvement. Really? A year between analyzing your results? Now, with real-time data coming in from digital applications, devices, and services, we can know, oh, you walked, your trend last week was 10,000 steps a day, and now it's trending down to 9, and now it's trending down to 8. And we can use either social or game mechanics or other behavioral factors to re-engage you. I'm not saying I'm 100% sure this is going to result in the cost savings, but it's going to result in a dramatically different human experience for the employees, which is a big part of what employers are looking for. And so, I mean, just Jiff, what we're doing is we're connecting all of these digital health application services and devices to the employers. We don't believe that we are taking an ecosystem approach. We don't believe that one company can out-innovate the ecosystem. We believe the best weight loss programs, the best stress management programs, the best devices, and if you go downstairs, you're going to see how many new companies you've never heard of that have digital health solutions, right? So we're taking an ecosystem approach, which is a little different than other people, but it's just one approach. And I think all the innovators here think they've seen the same thing, right? Yeah. We've seen the same thing, so my 2 cents.
The interesting thing about wellness programs and projects that go on is the quality ones will last and the quality ones will get engagement. And the ones that are not innovative and not very interesting and, as you suggest, painful and non-interactive will fail. I had experience with a S.C. Johnson out of a little town in Wisconsin, and how does SC Johnson recruit and bring people into that little town and get them engaged? And they use their wellness program as a recruitment tool for engineers. They bring in 20-year-olds fresh out of university that are really keen, really excited, want to go do some nightlife stuff, and instead they're going to Racine. No offense to Racine. I live in Bragg Creek.
I worked there for 17 years. Did you?
No, I didn't know that. I'm sorry.
And it is a big draw.
But it's a huge draw, and they pay. Every employee pays $100 a year to be part of their wellness program, and you don't get hired if you don't participate. And yet, it's a recruitment tool. So obviously, there are wellness programs out there that engage and excite and enthuse people and motivate people, and you just have to find the right one. You have to find the right tool that will motivate people, the right one that will authorize him to get off his butt, or her off her butt, and get going. And that's why there are 20 or 30 downstairs instead of just 1 or 2, because everybody's got a different idea on how that's going to work.
Well, I think let me build on what both Derek and Paul said is at Jawbone, we're focused, you can talk about it in a corporate environment, but at a corporate environment, it's still an N of 1, right? At the individual employee level is where, the intention has to turn into action that turns into individual outcomes that turns into corporate savings. And so what we're focused on is how do we really take those intentions, turn them into action with what we believe is beautiful devices that, we like to think that we're solving problems for people in it, and they're willing to engage in our products even if they don't have a problem, right? That they're that seamless or that beautiful. And when we pair them with apps that are real time, they give them the insights and feedback, because all 5 of us sitting up here have different intentions, different needs, and different levels of engagement. And so if you can build something that is personable and flexible and real-time enough to solve for that, then you've solved at that N equals 1 level, and then you can start to have impact, in an organization.
So the N of 1, I think, is really an important idea. I think as powerful as that is, if I am 1 and I can actually change my behavior, I can start to impact the others around me.
Yeah.
And we see that happening pretty significantly. A lot of people in the industry talk about outsourcing. Let's get a doctor in here. Let's get a nurse in here. Our view is that we've got great people in organizations that know about health, that know how to eat, that know how to exercise, that like to do a lot of different things. And if they have a platform where they can engage other people in the changes that have created value in their own lives, then that company can be much more successful in doing it. So instead of the nagget, somebody calling in from the outside, if I've got somebody that I sit with and work with every day and they say, let's do this, let's go for a walk, let's have a challenge, let's do something else, that has much more impact than somebody coming from the outside.
Yeah.
Championing inside the organization.
That's right.
Yeah.
Giving champions tools to do that.
Exactly.
It's a bottom, kind of a bottoms
Organic.
up rather than a corporate down approach, and really grassroots motivation. And today organizations are global and virtual, right? So doing something in a physical workspace isn't always going to work. And so if you've got social elements or finding capabilities within your solution, you can really get far more inclusive.
Creating things that those champions can use, or offering things that those champions can use and get their activity or their enthusiasm credited, when normally they're already at the top of the level, so nobody's really paying any attention to them. But if they can get their exercise and their activity credited and acknowledged by the corporate or the rewarder, whoever that happens to be, that brings more enthusiasm to them and encourages them to bring the lower parts of the employee base up to an active level.
What we found too is if you can offer it to friends and family. So corporate workspace is great, and we connect to everybody in the corporation, and if you get a majority of people going there, they'll stay and do it. But you also want to connect with other people outside of that. So what we found was we started to offer free friends and family for anybody that had our program, because then they would reach out, connect with other people, and help sustain that same behavior change that they were trying to drive towards.
And you have to think about, one of the things you have to think about a lot is engagement. Like, what do you engage in the most, right? You engage in entertaining, addictive experiences. And so you really have to think about it as, at some level, they're social, but at some level, there's sort of this element of entertainment. And you have to, and what does entertainment do? You don't watch the same show every week and have a repeat of the same episode. You need a new episode. You need a little bit different new experience to keep people engaged over time, because one experience eventually will kind of wear itself out. And you have to build a platform or build a technology platform that can alter and change those experiences in a scalable way so that you can refresh it and people can have interesting experiences over time. Because one challenge might be interesting to me for 30 days or maybe even 90 days, but we know that kind of peters out, and then you put something else up there and it's interesting, and this is it's a new twist on the same paradigm, and people go at it again, right? And if you can really what we try to do is connect it back to if you connect it back to the physical world, which everybody's mentioned, it's not just about me in my head and in this wireless digital world. It's like connect it back to activities that are going on at the site, or walks, or other things that are happening, and connect it back to, and allow people to do that, to connect it to their real world. You get this amplification effect, which I think is really, really good. Not everybody wants to participate socially, so you can offer them an individual experience too, but it really amplifies it.
One of the other things that I found is that this idea of not everybody's created equal. Jawbone built some great, really nice stuff. When we go into corporation, we're trying to get 100% of the population involved. And so you have to have solutions then that mirror or match kind of where that person might stand. And we have a device in the marketplace, but it's for the everyday person. This is the one that is very easy, low cost, easy to use. They don't have to spend a lot of money to replace it. We find people lose these a lot, and they don't want to spend a lot of money to replace them. So you've got to think about a holistic experience and meet the employee or the customer where they are. Because if you can't have tools like, if you don't have options, I got a high-end one and I got a low-end piece, you're not going to be able to engage everybody that you want to engage without those kind of options in your program. Back to Derek's strategy and point, which is there's a lot of great programs out there, a lot of great devices. Integrate to them all. We're device agnostic that way. We want, use what you like.
And I think that this group here, in a lot of cases, we're looking at partnerships. We're not the total solution, and none of us are the total solution. Yeah. We have to find other partners that are going to engage with us and do what they do well. And the conductivity and the interconnection between service suppliers or hardware suppliers to that corporate entity and then to his individual employee is really important. And being able to have those things communicate easily and seamlessly. It has to be easy all the way, because all of these people think it's a terrible burden to get off the couch or out of the chair. So we have to make it as easy as possible. Technology is often a challenge, so it has to be a simple device, simple tools across the board. Just put it on, wear it, don't worry about it. The data will go where it's supposed to go. You can have a look at it later. You can look at it now if you want, but it has to be simple. And the interface between the various partners that are engaged has to be seamless and simple as well, or appeared at least to be that way.
Yeah. I feel that way.
Yeah. Well, you need to, and we've done that within our ecosystem, in the partnerships that we choose to build out a better experience. Kind of what Derek was saying, people are going to change over time. I feel like I'm sitting on a railroad station.
Something's happening underneath.
So we built an ecosystem so that, because when people come into our product, our up product, they're at a certain place, and our goal is that they take action, they move to another place, and they have new needs and new desires and wishes at that time. And so whether we can, within the hardware software offering we've built, or we have partnerships that can, enhance that experience, move them on to something else, because no one solution in a siloed, when BodyMedia first got into the space 14 years ago, it was a siloed solution because the ecosystem that we talk about here, that all of you represent, didn't exist. I mean, this conversation didn't even exist back then, right? And I think just the cell phone, outside of healthcare, what the cell phone and Steve Jobs and Apple did for the fact that the notion or the expectation, right, that we can customize things, whether it's as simple as customizing the home screen on our phone, our smartphone, or the fact that I can have data from my bank come here and I can take a check. I was showing my 90-year-old stepfather over Christmas, look, I can, deposit a check sitting right here by taking a picture of it on my phone. That's just like, and so the customization and the world revolving around me has drastically changed in the last 10 years. And I don't think healthcare or sensors or kind of the corporate wellness environment is any different. That movement is shifting very, very quickly. And so companies that can partner well, get the interfaces right, get the partners right, are the ones that are going to win and rise to the top. Yeah, I think half those ones on the floor down there won't be here next year, but that's
So do
my
I.
prediction.
Maybe next year, but in a few years.
I come from
I
the.
mean, have you seen, 3 years ago we were here, and there was like 12 booths in the Digital Health Summit or something.
Yeah. Oh, yeah.
And it's just, it's massive, and the traffic down there. So it's wearables and this connected device world in digital health is not going away. A lot of them will fade by the wayside, and leaders will emerge. I think Jawbone has already emerged as a leader, and some other folks have emerged, but it's here to stay, and our train is passing again.
I came from a background in the sporting goods business, and I was around in the late 80s and 90s when the snowboard people came into the ski business, how disruptive those young punks were to the ski business. But I watched in 2 years 10 snowboard companies turn into 2,000 snowboard companies, and then in 2 years, 2,000 snowboard companies turn into 6 snowboard companies. So it's there is an opportunity that people believe they can take advantage of, and entirely justifiably. And the good ones that will do the things that need to be done, get the right kind of data, get the right motivators, get the right participation in the partnerships, make it all easy, make it all seamless. Those people are going to survive, and they'll be the ones that make the money, and the other ones that don't offer those kinds of tools will find something else to do.
I think one of the things that's critical, though, is if you're going to sustain behavior change, people have to, there's a psychological aspect here that people have got to kind of get their head around. The devices, tools, incentives, challenges, competitions, all that's fantastic. People at some point, there's a real science, I think, helping people realize how they're feeling after they've made changes and how they think about themselves. So there's a psychological aspect here that's terribly important as you move from the extrinsic motivators to the intrinsic motivators to reinforce along the way so that they sustain that behavior change. The tools will be there, and the tools will change. You'll have winners and losers that come along. But as people change the way they think about their lives, themselves, and their health, that's what needs to happen in order to kind of keep those changes alive and reinforced over a long period of time.
Can you talk a little bit about how digital health is going to enable individual employees to better track their personal successes and track their own? We talk a lot about optimization and customization depending on where you are. So there's a lot of potential for me to see how I've been improving over the course of a year, but it also allows employers to see how their employees are faring, because they certainly care a lot about what products are effective. So can you talk a little bit about how digital health can help guarantee better data, not only for individual employees, but for employers as well?
I can just talk about what we do. So that's one of the reasons we're taking an ecosystem and a platform approach is we don't think we know which one's going to win. We don't think we know, but we think if we watch the data and we have the digital exhaust coming in, that the digital exhaust, we can analyze it and figure out not only which one's going to win, but the reason there are so many apps isn't because I don't believe there's going to be that the same proliferation in apps and the collapse in the proliferation of apps is going to happen, because apps, they do a few things. They do one thing really well or a few things really well, most of the good ones, and they microsegment the population like crazy, right? So the reason there are so many apps is because the one that works for me doesn't work for you, and the one that works for me doesn't work for Chris. And so what we need to do is see the data. So our platform approach is to watch the data and to connect to as many people as possible and let people choose, and then we'll see which ones work. So there's a little bit of, we don't let employers see the individual employee data and see them progressing. So that's sort of generally, none of us let anyone do that. But for us, we connect employees to the employer experience and to the incentives and the infrastructure and the benefit design. But we rely on, when I want to do my individual tracking, Jiff doesn't generally supply the individual tracking. We allow people like Jawbone and other people to supply the really individualized, personalized experience because our platform doesn't need to repeat everything our partners do. We just provide really amazing data to the employers about what's working and what isn't working. There are different approaches, but we rely for the individual experience of how am I doing and I'm doing better. You're using generally one tracker. Most of what you need is there. They generally have a strategy that looks at a comprehensive view of your health. We know what's happening and use that data to link them to experiences that are employer specific or incentives, but we don't kind of have an individual experience about your view of health yet.
We actually had an interesting experience, and I think it exemplifies the white elephant in the room, if you will, the big elephant. And that's that, if you think about all the, let's say, outside of healthcare, like your banking information, everything you put into a phone. We don't, we feel comfortable for whatever reason that we can put that data there and it's safe and it's protected and privacy is near and dear. Even when you think about healthcare, so think about all of the healthcare information that your provider, your insurance, or not your provider, but your payer has, your insurance company, right? Think about it, all your doctor visits, your prescription refill, all those things, they already have. We were working with a payer, and we were offering a device it was a pilot program. We were offering a free device to a subset of their employee population, one of their clients' employee population, to be part of a broader program that they were piloting. And the first couple employees that they reached out to as part of this pilot program said no. And when we probed why, they said, because I don't want my employer to have access to that level of data about my life. Now, forget about the fact that we do have privacy, it's our data, it's on our servers, et cetera, but just the notion at an individual employee level that someone who already has all of your medical record information, they put personal information, in our case, about devices, almost in a different class than they do everything else. And so it was just an interesting problem to have to kind of think through that we weren't necessarily prepared for. But I think it exemplifies one of the many hurdles that we have to get through at the organizational level, but probably more importantly at the individual level that we have to solve for and get people comfortable. How do you communicate that? How do you ensure them that their employer, doesn't necessarily have access to what they eat and how they sleep and how many steps they take a day, unless they choose to or they're forced to.
Just a 2-second funny story. We had a lawyer at one of the lawyers was challenging us and said, well, what if HR, someone's called in sick, right? And they think they're out surfing, right?
There's another, there you go.
And they said, would you allow this HR person, to get into the data to see if they were active that day or not? And I said, never. And they said, good answer.
But the employee doesn't know that,
the
right?
employee doesn't, there's no awareness of the employee about the laws that protect them from us giving that information. So there's a big education opportunity, but there is this fear, and I think the lawyers at the companies are crystal clear about, I don't want to see individual data at all, never, stop.
It's as you say, it's an education process because, frankly, your grocery store loyalty program is getting far more personal data from you on your purchases than you would get from a wellness program in any corporation.
Yeah.
Your credit card, your health insurance company. all of them.
Yeah, we found that as a Virgin group, that's been an easy hurdle for us to overcome because they look at Virgin as a outside company, a trusted kind of third party, and they're much more willing to say, oh, okay, how does this work? Who gets what information? The onboarding process, though, can be one of those great times to educate people on really what happens and what that relationship looks like to put their to ease their fears, if you will. We did a study once, kind of a similar study, and there was 2 options. One option just that we kept the information. The other option was the insurer got the information. There was a more than 60% decrement on sign-up process in that same, those two cohorts in that population as a result of just saying your information's, available to somebody else. So it's a key issue for people.
That's a good high five on the study for that. Showing the payers that, hey, people actually don't trust you.
You got to call a spade, though, right?
Whatever it is. And lots of them are doing good things now.
That's right.
And, I think they're vilified in a lot of ways, but that's just a big barrier to adoption.
Well, their job has not been one of consumer engagement, right, for a long term, right? And nobody loves their insurer because when they typically deal with them, they've had a bad experience with the doc hospital, have been in pain, they've been sick. And so it's a tough place to be coming from then to engage them in consumer. And a lot of them are fixing that and changing that, there's no question.
Yep.
But they've still got a long ways to go from that, just the primary relationship they have.
Let's shift the conversation here just for a moment and talk about what seems to be a very hot topic in my office. And I'm not sure if this is something that you discuss when you're trying to promote your tools, and that's their capability for cost savings for employers. It seems that integrating a a digital health tool in the workplace is much more cost effective than having one-on-one educational programs or having people on site do scary blood withdrawals and sending it to a lab wherever in some undisclosed location, and then having a strange nurse call you on the phone and nag you. That seems like a really costly intervention, whereas your interventions have the ability to dig deep into the employee pool, have the ability to increase engagement and excitement, and also have the potential of saving money for employers. Can you talk a little bit about the promises you see either now or in the future for saving money for employers?
So, who wants to jump? This is a tough one.
Yeah.
And the reason this is a tough one is very, very hard to prove that you've actually saved money long term for corporations. What's been interesting to us is every client that has done a study to determine whether or not they've got cost savings have all shown they have had cost savings, and significantly so. And they're pretty good studies. But any really good quant jock can probably shoot some holes in those things, and that's okay. What we found is our clients are actually saying, let's measure the things that we can measure up front. Do people use the program? Do they like the program? Have they changed their behavior? Is this a positive for us? 67% of our members actually say that because their company has our program, it's a better place to work. Those are the types of things that employers really want to hear, because again, this is not necessarily about healthcare cost reduction from my perspective. This is about the relationship you have with your employees and really building a great place to work. Yesterday, I spent some time with a client of ours here in town, Zappos, and we had this exact conversation. They said, we can't prove that these things work, but we know they do because of the culture, the work effort, the ethic that we get out of the people. We totally buy into this. We believe in it kind of heart and soul. And those are the clients that we actually look towards most, because they just know, they understand that human experience that you've talked about, Derek, that if I provide something of value and of benefit to my employees, they'll reciprocate. Our tag, we think about this as show your employees some love and they're going to love you back. And we think that's absolutely true.
Yeah, we have a one-word answer. No.
Good.
Nope. Not gonna prove outcomes. Maybe after we gather enough digital exhaust in a few years and we have a whole bunch of analytics and we can figure out what works for different employees, maybe there will be some. But it's all about, if you think about creating human, engaging experiences for people that tie to the culture of the company, very much like Chris just said, and you think about the cost of this platform and this solution as a percentage of their salary, it's infinitesimally small, right? If you think about it, I have this wellness budget, I have to get it approved, it has to prove, it has to an ROI. If I walk in and there's a CFO and they have this big ROI, everything's got to be validated by ROI, I'm like, great, you're not our customer. Next, right? I mean, it's simple, right? No.
I think we see the same thing. It's about our morale, opportunity. It's about creating a sense of community that goes beyond just the debate that happens in a meeting room, right? Like, how can you use wellness programs, challenges to engage your employees at a different level than kind of the gnashing that has to go on when it comes to business debate. I would say that the other thing that we did, and this was pre-acquisitions, this was a BodyMedia study, is we didn't necessarily look at an organizational cost effectiveness or cost reduction, but we were able to show that for those who you had to engage with, that were probably that 20% that were driving 80% of the cost, that when you involve technology, in particular BodyMedia technology, that the cost effectiveness of incorporating technology was there. That, let's say the cost of the pound per lost, when even though the total price may be more than the $10 or $15 you pay for a pedometer, we had the engagement and the outcomes, and therefore the cost effectiveness in terms of outcomes was far better with the technology than when you didn't have the technology. So there's different ways to ask that question, right?
Yeah.
Organizational cost reduction or cost effectiveness, related to outcomes.
One of the interesting things is that if you are monitored, if you're watched, you're more inclined to perform what's expected of you. That's sort of natural, basic human nature, and that's what's going to happen. And so if you have a monitoring device, then you know you're being watched, and therefore you're more likely to complete the tasks assigned. It's simple human nature, and that's what these devices will do, is get people just a little bit further up the line. Eventually, they're going to be self-motivated. Eventually, they're going to be their own authority, having jurisdiction over their their own health. But it's going to take a little while to get there, and a device is the tool that will get them up the ladder, even if it's not going anywhere.
Yeah. And just, I mean, just to kind of little bit of a shout out to BodyMedia, because I think they've been absorbed by Jawbone, and there's bigger and sort of more well-known brands. But I mean, BodyMedia, along with other companies, when I was the CEO of Health Hero, which did remote patient monitoring for chronically ill patients, I mean, they pioneered this space, right? Wearable devices that collect data, and the amount and quality of the data that the BodyMedia devices collect was amazing, right? Just amazing. And you know at the end level, and for that higher chronic or pre-chronic cohort, we know we can save money. And I think your study showed that, right? That seems to be the place where it saves money. I think in that healthy lifestyle, or kind of on your way to being unhealthy, that's where we just don't know. And we don't have solutions for this upper percentage. But it's like, I think that it's clear that this chronic and pre-chronic group, there are solutions that save money, that will be a positive ROI. And that doesn't even take into account any ROI that flows to the employee themselves, right? Which is huge. But in that other group, not sure. Our answer is no. Don't look to it from us. We're not going to do a spreadsheet or anything that shows you anything like that.
It's all smoke and mirrors anyway.
Yeah.
You're gonna,
I can bend the trend. I was
Exactly.
VP of Outcomes
Not
Analysis.
everybody thinks that. Not everybody thinks
But
that.
I was VP of Outcomes Research at a very large disease management company, and let me tell you, I can make this spreadsheet say almost anything you want them to say. I mean, how can you tell that you bent the trends, right? How can you tell? What would the trend have been? That's the hardest question to answer, and you cannot answer it, right? You can estimate it. You can put a whole bunch of smart people in a room and get some, but what would it have been is just almost impossible to answer. So.
But you can measure how many people are involved in the program.
Totally.
You can measure things that matter, like how many times do people come back to the site? Is this a daily behavior change? Is this once a year? Back to your initial point. You want to get people thinking about this daily, right? So it becomes top of mind. Once it becomes top of mind, people take action on it. Yeah. And so you can measure those types of things, and companies can see pretty great satisfaction.
and that's what people are rewarding for. They're not rewarding for improved health conditions based on their annual health. They're rewarding for participation.
That's right.
I went to the site. I did what I was supposed to do. I'm active and involved and engaged, and therefore I get it. And if I have a heart attack, I have a heart attack. But that's not as a result of my inactivity or activity or participation or non-participation in the program. It's they want to make sure that people are participating. The insurance companies want to make sure that people are participating, particularly these days, as insurance companies have an obligation to provide insurance. It means that the only way they can stay in business effectively is to have fewer claims. And if they have more people participating, then they have fewer claims. And if they think it's an ROI, they're the ones that can figure out those numbers better than the rest of us.
Okay, and just one more question, and then we'll open it up in case anyone has questions for the panelists. What do you think is the future of digital health in the workplace? And what are you looking forward to in the next 5 or 10 years? And clearly this has been a growing field, and it's really exciting to see all the innovation taking place on the ground. So what are your hopes and dreams for the next 5 to 10 years, and what do you think is happening?
Well, I think, Jawbone, we like I said, we come down to the N as one, right? We're focused on the individual, where they're at, and meeting them there, and then helping them progress beyond. And to us, the corporate workplace is just one of many avenues. It might be their friend base, it might be their social base, their Friday night, dance club. I mean, it's those, all of those things matter. And so, yes, you want to pay attention to what goes on in the workplace because it's the single most important place we spend a big bulk of our time. But we prefer to think about it at an individual level, and how do we affect change and action there, and that will roll up.
Yeah. And I mean, at Jiff, I mean, and me personally, I mean, we're just incredibly excited about the opportunity that that connected devices and connected applications and connected services represent. We believe that not only will all of these things digitize, but a bunch of care will be virtualized. It will impact employer wellness dramatically. And being able to apply that to, you know, incentives and benefit design, and especially to culture and how companies create a positive health culture, that's incredibly exciting. And I mean, I'm just amazed at how many companies are down there, and I'm positive there's going to be a shakeout. But I think we're at the very beginning of the connected device app service revolution, and we think that in 5 to 10 years, you're going to have individualized solutions to a degree that maybe even we can't even imagine now, that will be provided by a variety of suppliers, but that the solutions will really tailor themselves down to the individual. And the people who do that the best will win, right? The people who can figure out me and then figure out Chris and figure out Paul differently, that know that we're different, even though we might have a similar demographic, those are the ones that are going to win, and that's going to be amazing to see happen.
So I think personalization is one of those areas that's going to be really important and will come to fruition much more. But I also think breadth, where our understanding of what is healthy behavior, I think will expand significantly over the next period of time. There's a whole line of thinking now that our decisions, the way we think about things, what we do actually changes our genetic dispositions and turns things on and off. And so I think one of the things that I'm most excited about is a broader view of health. Most of what we're seeing right now are physical activity trackers, things that are physical in nature. But I think as you get into mental resilience and stress management and a whole bunch of other areas, financial health being one of those things, I think there's a lot to come in kind of rounding out the consumer's view of what's healthy, how do I help you be healthy across the board, because mental health, physical health, emotional health, and relationship health all combine to change kind of the human condition of the experience that we have. And that's where I see a lot of growth coming.
Yes, I'm inclined to agree. I think that right now we're dealing with, we're dealing here with activity. But there's so many things components of a wellness program that don't necessarily involve activity, but we don't have a good tool to use to monitor those things. I believe that those tools are coming along, and certainly the people that came to our booth today and yesterday, the guys with hey, want to buy a watch approach.
I can't help.
These guys are coming with an idea, and they're promoting their cool idea and hoping that some big company that's already successful in the industry picks it up and runs with it. And they're doing brainwave stuff, and they're doing sweat analysis, and they're doing all kinds of weird things. And eventually, one of those or two of those are going to take hold, and they'll be really useful tools in the future. But right now, this panel is dealing with activity, getting people up and active. One of the things that I'd like to see in the future is that the individual person, be it a corporate wellness employee or a corporate employee or just a person on the street, he takes his own responsibility for his own health programs. If he can see that data and monitor it, engage it, and find out what he's doing, and find out what he was doing, and see how those behavior changes were happening, that's great. That will allow us as connected devices to go to a central place and let him see that stuff. But he needs to take his responsibility for his own stuff, and I'd really like to see the general population do that. And that's what I'm hoping for the future.
I think there's one thing I missed that I really, really want to see. So one of them is it's like the mass marketing of quantified self is kind of what you're talking about, is like the mass marketing of quantified self, people understanding where they are. But what I really want to see, that I don't know if will happen, but is passive food monitoring. Like something that you can, like when I put something in my mouth, the calories get tracked in my device. I just need that because, man,
he was
passive food
the
monitoring.
booth. He was by the booth today.
We gotta have one of those because that's
we can shut it off.
this whole thing. This we can shut it off.
Let me see if I still got
but
his
we'll know
card.
you shut it off. We'll know you shut it off, right? We'll know you, and we can tell you to turn it back on. And but it's like this. The food tracking is when you food track, you lose weight. Been proven, shown multiple times.
That's right.
Man, food tracking is a pain in the just awful. So passive, and there was a Kickstarter device that went on and got off, got taken down, but it's like somebody's going to figure that out, photos or infrared or something, and that's going to be revolutionary. Right.
Wonderful. Are there any questions from the audience?
Thank you. Yes, we have a question right over here. And by the way, if anyone hears about that particular device that you're talking about, I will join the beta group.
Oh
Yeah,
my gosh.
exactly.
Okay.
Send
Come on,
me
stand up,
100.
please.
So, yeah, I'm Katie Stenson. So I have a question basically around how concerned are you about people trying to fool the system so that they'll either put it on their cat or they'll put it in the washing machine or whatever. I know that I've heard from certain devices they are worried about that and they try and come up with ways so that that doesn't happen. Like, do you actually see that happening when you're monitoring people?
So step number one, at least they're engaged, right? I mean, at least they're like trying to trick us. So that's like one thing.
That's right. That's where I would go with that thing. If they're trying to cheat, at least they know they're cheating, and
So-
their guilt will be enough for lose a couple of pounds a year.
But
do you
they're
think, like,
we definitely have algorithms to notice sort of
Exactly.
blatant fraudulence, right? Blatant. If someone's really smart and really tricky about it, it can be hard to see. But there are algorithms you can put that see sort of the blatant fraud.
I think the other thing that I would say about that, there's a social reinforcement mechanism here. If somebody's in the middle of a challenge and they're putting in 40,000 steps a day, everyone else is like, not a chance. You're not telling the truth. And a lot of people will not put their professional career at risk by cheating on stuff that then is somewhat social in that way. And so you could run the algorithms, but we actually find it pretty self-reinforcing. We had one client that said, okay, somebody took a snapshot of somebody having it on their foot and tapping their foot, right? And they sent the video around and said, who's that? And everybody in the organization knew who it was because everyone was paying attention to who was cheating in the program, right? And it was really interesting dynamic, but the social reinforcement's pretty good.
Okay, that pretty much ends.
We also found in our research that peer pressure is actually more important and more effective. We found this at a qualitative level, so I can't quantify this, but that peer pressure is more effective than offering financial incentives. So I think finding creative ways for integrating these tools into the workplace to create a culture of wellness and that expectation is a really powerful tool.
So my name's Greg Matthews. I wanted to ask, we know that organizational culture is a really important part of how employees adopt wellness programs. One of the things that I've looked at is that companies do these, what you might call micro obstacles to being healthy. Like maybe they have a dress code that's not conducive, or they have really early hours, or they don't have a place where you can park a bike, or they don't have showers. Do any of your platforms or tools do anything that might help employers to identify those micro obstacles that they may not be seeing and actually help them to promote the cultural change?
So at the level you're talking about, you really need HR to pay attention to this, right? And to kind of best practices. One of the things that is kind of the highest hit rate for our clients who've stayed with us year after year after year is we get our clients together, they talk to each other about their best practices, and it's at it's at that level that they start to learn and say, oh, you guys are really good at this, what have you done? And they start talking about their walking paths and their bikes and their dress code and some of the other things that you've mentioned. I was at, again, Zappos yesterday. They have big signs right by the elevator about taking the stairs, and they share those kind of best practices with one another. Very organically grown, but those things actually have a lot of power and sway peer-to-peer, client-to-client.
We're a technology platform, so we don't have as much infrastructure to influence culture, and that's why we partnered with Towers Watson, which is a massive benefit consulting firm that helps companies figure out what their culture and benefit design and their wellness solution should be. And so they do a lot of that work. They have these huge conferences. They bring people together. A lot of it's just best practices and convincing, the cultural leaders within the company that they need to make these changes. Yeah.
We have one more question.
Hi, my name is Susan Silver. This is hypothetical. I'm into wellness fully. I have an entire HR staff of people out there ready to send all of my great shape people out to all your companies. Is there any tracking done on which are the best companies for people who are also involved in this to go to?
The ones on this panel should be your
That's
starting
right.
point. Sorry.
At least a
We
couple.
probably all work together.
Want to buy a watch?
We got a contract for you too later.
But I mean, it's hard. So I honestly think that you've got a good representative sample of some great companies. We all do some different things. And there are great companies out there that you should be looking at. I think I would look at the more innovative ones that really have a strong consumer experience. If you go to their website and it doesn't look like a consumer website, you probably want to think second about where they come from and what they're trying to do. So that's all.
I would say don't go to a company that has a very promising ROI, because they might have some questionable methodologies.
The scientist, the researcher in the group.
I do think that there's, just like for an individual, they'll have different preferences. Different companies will have different preferences as well. And you want to be able to have a product that can configure kind of where you're at and what it is that you're trying to do. The one thing that I have seen with HR is they're all on a journey from one place to the next, and they need a platform to grow with. They need tools to be able to utilize, and they will change things up over time, and you want to be able to make sure that company has the tools that it is that you're looking for from that HR perspective.
Those are the kinds of questions that you need to be asking the people. What is the platform that you want them to provide you with today? And then what are the tools that they're offering that can allow you to take that platform and move forward with it as your population improves in health and gets more interested in, and the alternatives that are out there for them to use are necessary.
We're going to have to cut out. We have one very, very fast question, and then we really have to wrap it up.
So my name is Mike Payne. I'm with Omada Health. A quick question about ROI. One of our speakers yesterday said that prevention is not just for healthy people. And I think, Derek, you were talking about the fact that there are some programs for soon-to-be chronic and currently chronic patients that have high ROI. For us, pre-diabetes modeled on the CDC's program is a clear example of that. But it's an interesting transition that I think I see happening. I'd be curious about your opinion about this. Are employers starting to really engage at the disease level?
Yeah, I think you are right. So diabetes prevention, people who are pre-diabetic lose weight, clear clinical evidence that works, that there's an ROI, that it's huge, and that it's really important. That's one of the pre-chronic ones I was talking about. I'm seeing that they're starting to engage in it. I think they want really robust, when you get to solutions for people with chronic illness or pre-chronic illness, they want solutions that are robust, that are clinically sound, that are based on guidelines, that have support like yours. And and I think they're willing to start paying for that, and they really want to pay for it out of the medical expense. They don't want to pay for it out of the admin expense where some of our money comes from. Right. And I'm encouraging them to do that because it's reimbursable. It's a clinical program. It works. It's been shown. There's clinical evidence. So I see people being willing to do that more and more, and I think it's going to accelerate, especially virtual digital solutions like you have that are not sort of physical world-based, and are group therapeutic models. Just awesome.
I'm sorry, we're going to have to wrap this up. Thank you guys so much. A big round of applause. Great session.